According to World Health Organization, the Filipino healthcare system is fragmented because there is a history of unequal access to healthcare services, especially to the poor. There is a wide gap between the rich and the poor, as the rich can afford all the health-related expenses. Our country suffers a shortage of human medical resources, such as the doctors and nurses, because of low income and lack of benefits and incentives. More and more skilled doctors are turning away from it in favor of private practice or working overseas. The shortfall of doctors in the public sector has also caused problems for certain patients who are looking to find a specialist when they are facing a medical emergency. This means that even though basic medical care is available throughout the country, some hospitals only provide limited treatments, making it hard for everyone to access them. There is also a shortage of non-human medical resources, such as medical equipment and medicines. Public hospitals are usually in rural areas that are more rundown. These facilities have less medical staff and low supplies. 70% of health professionals work in private hospitals, while only 30% are in public facilities. Of the 17 regions of the Philippines, only 4 regions meet the minimum standards of hospital beds per 1,000 residents. Many patients are unable to receive the surgical care that they require because of a shortage of high-quality operating room equipment in the Philippines. During pandemic, it is said that the access to healthcare became worse. On March 21, the Department of Health or DOH called for volunteer doctors and nurses for 3 referral hospitals for COVID-19 patients. But the public was outraged by the department's meager offer to these volunteer frontliners, a mere 500 pesos daily allowance, free accommodation, and free food. Not only are the nurses underpaid, sometimes they aren't paid anything at all. The Dollar document also reported that new graduates in the Philippines usually work as volunteers first, with only a few hospitals paying or providing them a minimal allowance. Dr. Lichin said Filipinos have built a reputation as being among the best doctor and nurse graduates in the world. Unfortunately, for those who have remained in the country, the infrastructure is poor, both for them and their patients, he lamented.